video of mine is about a condition known as urticaria in medical terminology, and in simple words we also call it hives. These are actually red itchy welts that result from a skin reaction. The welts vary in size and appear and fade repeatedly as the reaction runs its course. This condition is considered chronic hives if the welts appear for more than 6 weeks and recur frequently over months or years. Often the cause of chronic hives is not so clear. These hives can be very uncomfortable and interfere with sleep and daily activities. For many people, antihistamines and anti-itch medication provide relief. Now let's discuss some of the symptoms of the hives. Firstly, these batches of red or skin-colored welts which can appear anywhere on the body. They vary in size, they change shape and appear and fade repeatedly as the reaction runs its course. Itching, which may be very severe. They also come up with swelling, which we call angioedema of the lips, eyelids and inside the throat. There is a tendency for signs and symptoms to flare with triggers such as heat, exercise, and stress. A tendency for signs and symptoms to persist for more than 6 weeks and to recur frequently and unpredictably, sometimes for months or years. That's what we call chronic hives. Now let's discuss some of the features in acute hives. What happens is actually these short-term hives they appear suddenly and they clear up usually within a few weeks. So acute hives usually appear in the form of there is a background of some allergic reaction, which is a medical emergency which can lead to anaphylaxis. So if you experience these acute hives as a part of serious allergic reaction, you should go to seek emergency. And the signs and symptoms of these include dizziness, there is a breathing difficulty and swelling of your lips, eyelids and tongue. I'm talking about the anaphylaxis due to acute hives. Now let's discuss some of the causes of hives. These welts that come with hives arise when certain cells release histamine and other chemicals into your bloodstream. We usually identify the reason for chronic hives or why sometimes acute hives they are coming with the long-term problem, and the problem the cause can't be identified. But the skin reactions can be triggered by some pain medications, insects or parasites, infection due to scratching, heat or cold, stress, sunlight and exercise. Also, it can be triggered by some of the foods or alcohol. There could be some pressure on the skin, for example, due to tight waistband. That waistband can also lead to hives. Here you need to remember that sometimes these chronic hives can be related to some underlying illness. For example, thyroid problems are rarely, if there is some cancer in the body, that these can also appear. Let's discuss some of the complications. Well, there are actually no complication if the condition is chronic, but acute, as I mentioned before, the acute hives can lead to serious allergic reaction, which is known as anaphylaxis, which is a medical emergency. So you should seek medical care. Now let's discuss how we diagnose this condition. When the patients come to us, we take history and examination. We ask questions regarding your activities. Are you using any medications, herbal remedies or supplements? What kind of diet you are taking, and when hives appear and how long it takes for the welts to fade. And also we ask whether these hives come with some painful swelling or not. If we determine that these hives are due to some underlying condition, then we can ask for some tests. These are blood tests or skin tests. Now let's discuss some of the treatment options. If the condition is not severe, if it is not acute, then we may ask you to apply some home remedies. Okay, and also there are over-the-counter antihistamine drugs are available, which we can prescribe or you can buy it yourself. If self-care doesn't work, then you need to seek the help of a doctor so that he can advise some medication which are best for you. The antihistamine which we usually prescribe initially are non-drowsy. These are, for example, loratadine and cetirizine. They actually help in blocking the symptom produced by releasing of histamine due to these allergic reactions. Sometimes these non-drowsy antihistamine do not work, so we suggest some medicine which can lead to some drowsiness. There is an example of this medicine which is very famous, that is known as doxepin. If these drowsy medicine also sometimes these drowsy medicine do not work, so we need to prescribe some other groups of medicine. As I mentioned, if these medicine initially non-drowsy medicine antihistamines, and then those antihistamines which can lead to some drowsiness, and if both of these groups don't work, then we sometimes prescribe the drugs known as H2 receptor antagonists. Okay, they can be given orally or injected, and there is a famous example known as cimetidine. Along with this, sometimes we recommend oral steroids such as prednisolone. That can be very helpful, but these are prescribed for only short term because these steroids have long term serious side effects. We generally avoid them, but for the short term release of symptom due to histamine release, we prescribe along with antihistamines. There is another group of drug which is helpful for the relief of symptoms. They are known as leukotriene modifiers, and that can be used with other antihistamine drugs. One example is montelukast, that is commonly available with the trade name Singulair. And sometimes these chronic hives are even very resistant, so we prescribe drug known as Xolair that is very effective against these chronic hives. It's an injectable medicine that is usually given once a month. In rare cases, we sometimes prescribe these drugs and immune suppressing drugs. That is, one example is cyclosporin, but they are used very, very rarely. Now I will discuss some of the home remedies which you can use to provide a relief for these hives. These medicines can be used at home and they can be prepared at home. You can provide soothing to the affected area by simply taking a bath, and also you can apply some cool cloth or lotion or any anti-itch cream which is available at home usually. We advise people to wear loose and light clothing, and you should avoid scratching or using any kind of harsh soaps. You should also keep a diary, and you should note that when and where your hives appear, at what time they appear, and what you are doing at that time. You should also note that is it associated with some kind of diet which you are taking, because these causative factors can help the doctor to decide the proper medicine for you and advise some tests for you. For example, you may have some food allergy, and we should also come to know the triggering factors. Okay. Also, it's advisable that you should apply sunscreen before going outside. I hope you like this video of mine. If you want to know more about some medical illnesses, please comment in the comment section of this video and tell me what kind of illnesses you want to hear. Okay, if you are suffering from any kind of illness, you should simply ask me and I will try to make a video on that topic. Thank you very much for watching this video. If you have not subscribed my channel, please subscribe it as soon as possible, and if you like this video, please share with your friends and families. Thank you.